I'm joined now by Dr. Richard Besser. He's the former acting director of the CDC, now the head of the Robert Wood Johnson Foundation. Dr. Besser, good morning. Thanks for your time. I appreciate it. I want to point out to our audience that you were acting CDC director during the 2009 H1N1 swine flu outbreak and held those daily briefings that we've become accustomed to at the White House. So let's start with Georgia and states that are now dipping their toes in the water and reopening parts of their economy. Obviously, you're coming at this from a medical point of view. But how do you find that balance? Because there are an awful lot of people who say, this isn't worth losing my business, my livelihood, putting food on the table to stay inside. How do you view that dilemma?
Yeah, I mean, Willie, it is a dilemma. Everyone wants to get back to work, and that's really important. But from a public health perspective, you want to do it slowly, carefully, based on the best public health science. And that requires a lot of data. You want to make sure that your cases have been going down for a couple of weeks. You want to make sure that you're able to test people adequately and know who's infected so you can get them isolated and get the people who've been in contact with them isolated. And overall, you want to make sure you have enough room in your hospitals because when you open the economy, there will be more cases. And if you are barely holding on in terms of treating COVID patients, think about all the people who have cancer and heart disease and diabetes who need medical care who haven't been getting it during this crisis. You need room for everybody.
You mentioned testing, Dr. Besser. It's become almost a cliche. People hear that testing, testing, testing. It's so important. Dr. Fauci underlined that again yesterday, saying we need to double our testing capacity before we can think about getting people back to work. Why, from your point of view, is testing so critical to reopening our society?
I mean, it's absolutely essential. And here's the reason why. Most people who get this infection, thankfully, are going to do very well. Right now, the healthcare is testing only those people with really severe illness to see if they need to be in the hospital if they have COVID. We have to be able to test people who have very mild symptoms because while they're going to do well, they can continue to spread it. So you have to identify people with mild illness. You need to find out who they've been in contact with and identify those people. You have to provide space for these people so they can be isolated safely away from their loved ones so that no one else gets sick. But right now we're only testing sick, the most sick people. That's not what's going to make this work when we really open the economy.
And quickly, Dr. Besser, I want to ask you about that confusion from the WHO saying perhaps if you get coronavirus, you're not immune from it. You could get it again. They walked that back a little bit. But is it true that if you get coronavirus, there's a chance you are not immune from getting it a second time?
Well, it's an unanswered scientific question, and it has to be answered. Not only, whether antibodies mean you're immune, but is there a certain level of antibodies that means you're immune? If you're immune, does it mean you can't spread this to somebody else? The WHO said that there's no science to say that you're immune. That means the science hasn't been done yet, and it has to be done. And it's really important if we're going to use that as a card to get people back into work. We don't know that yet. And there's so many antibody tests out there. They haven't been validated yet to know that they're measuring the same thing and what all that information means.
All right, Dr. Richard Besser, former acting director of the CDC. Great to have your expertise this morning. Thanks so much for being with us.
Thank you, Willie.